Good morning. As you've heard at the national level from the Coronavirus Task Force, increasing testing and contact tracing is strongly recommended to effectively track virus activity and manage it as states begin to reopen businesses and ease some of their restrictions. Despite a gradual increase in testing supplies over time from the CDC and the national labs, it was clear that unless we did more, we wouldn't have the number of tests that we wanted to confidently move to the next phase of recovery. 3 weeks ago, I announced the launch of Test Iowa, a statewide initiative to significantly expand COVID-19 testing for Iowans. Our partnership with Nomi Health created access to more than 500,000 FDA-approved diagnostic tests, the technology to process samples at the state hygienic lab, and the capabilities to enhance data analysis. I'm pleased to announce that the State Hygienic Lab completed the Test Iowa validation process yesterday, achieving high ratings of 95% accuracy for determining positives and 99.7% accuracy for determining negatives. And I want to just again commend Dr. Pentella and his team for their effort in getting this done. In the last 23 days since launching, Iowans have completed over 400,000 assessments on testiowa.com. More than 4,300 have been tested, and more than 4,000 Iowans have been notified of their results. Additionally, we've opened 8 drive-through test sites when the newest one opens Saturday in Storm Lake. Sites are also available at Des Moines, Sioux City, Waterloo, Cedar Rapids, Denison, Davenport, and Ottumwa. A lot has happened in a short amount of time. The rapid implementation of Test Iowa was necessary so more Iowans could get tested as soon as possible. Now we're focused on process improvement. As we continue to ramp up, we're working on optimizing our operations and improving the overall Test Iowa experience. For those Iowans who have reached out to tell us that we've fallen short of meeting their expectations, we hear you. Now that the lab has completed the validation process, we expect more tests will be processed more quickly and your results will be delivered on a timely basis. And in the next few days, we'll also be standing up a dedicated Test Iowa call center where staff experienced with the Test Iowa process can help answer your questions and resolve your issues in a more timely manner. I want to thank the 211 call center and my team at the Capitol for taking those calls the last few weeks and doing your part to assist Iowans in need. I greatly appreciate the teamwork that has gone into supporting this important effort. Test Iowa is a big part of our long-term recovery plan, and we could not have expanded our testing capacity to this level this quickly without this opportunity. Test Iowa will help us ensure our ability to sustain increased testing levels over time so that Iowa's health and economy can recover and grow. You know, the COVID-19 pandemic has been a challenging situation in every way, but nothing has been more difficult than its impact on older Iowans, especially those who live in our long-term care facilities. Knowing that the virus posed the most risk for adults over the age of 65 and those with underlying health conditions, we began proactively planning for how best to protect the residents of long-term care facilities even before our first positive cases of the virus were identified. Then, in the days immediately following, we began putting mitigation efforts in place in our state-run long-term care facilities, and the Department of Inspection and Appeals issued similar guidance for nursing homes, residential care facilities, assisted living facilities, and adult day services. Proactive steps were taken to protect the health of the residents in these facilities, including restricting visitation, implementing staff health screenings, and suspending communal dining and group activities. While these steps are necessary to protect our most vulnerable Iowans, they also have significantly changed life inside Iowa's long-term care facilities. Today, I've asked Maureen Cahill, the administrator at Spurgeon Manor in Dallas Center, to share how she and her staff have adjusted their work to protect the health of their residents while continuing to provide the quality of life that's so important for them. Hi, Maureen. So thanks so much for joining us today.
Well, thank you. Thank you for the opportunity to discuss how things are going in long-term care. Like you said, my name is Maureen Cahill. I'm the administrator at Spurgeon Manor in Dallas Center and also a member of the board of Iowa Healthcare Association. For myself and my team, working in long-term care is not a job, it's a calling. My daughter is also an administrator in long-term care. We care about our residents and they're like family. In fact, my mom lives at Spurgeon Manor. It's not an easy job, and COVID has not made it any easier, but we deeply care for our residents. We provide care for their physical, spiritual, and emotional well-being, especially now that family members are restricted from in-person visits for their protection and per CMS regulations. This morning, while making my rounds in the facility, I asked several residents if there was anything they wanted me to share with the governor, and every one of them said to let you know they're doing just fine, and of course, they miss normal visits from family. The Spurgeon Manor staff are doing a good job and taking good care of them. Long-term care facilities are trained in infection control and standard precautions, but due to COVID, we are taking additional preventative measures like entrance screening and more frequent cleaning and PPE usage. We screen every one of our staff for symptoms and check temps at the beginning and end of their shift. Anyone with symptoms are not allowed in. Cleaning is something that we've always done, and now it's even more critical, and all staff members are wearing masks while at work. We also have an emergency response plan ready. Plan A is to keep the virus out of our facility by using all the precautions, and so far we've been successful. Plan B is to contain the virus. If we do have an infection, we have a dedicated isolation area for treating any symptomatic or COVID positive residents. And we have prepared by providing extra training with our nursing staff and our non-nursing staff to help combat the virus. Our dietary, administration, and environmental services staff have taken the temporary nurse aid course offered through the American Healthcare Association. Our families are worried about our residents getting the virus and also concerned about their emotional state, very similar to what you're concerned about for the residents of our state. So I email an update to our family members almost daily to let them know the status of Spurgeon Manor. Our activities directors meet with the residents and provide them with a letter daily suggesting activities they can do, and it includes exercises, jokes, devotions, and an update on the status of Spurgeon Manor. We have implemented a number of alternative and safe ways for families and residents to communicate while adhering to regulations that prohibit in-person visits and help protect residents from exposure. Window visits, electronic visits like FaceTime, Zoom, and Skype, phone calls, and support of our community with cards and the parade. Parade is like Christmas, Easter, and the 4th of July all rolled into one. Every Thursday at 2:30, we look forward to family and friends driving by, waving and honking with their decorations and signs. We're so happy to see everyone that sometimes we cry. And then we're sad it's over and we wait again for next week for the parade to start again. Our activities and direct care staff are also providing ways for residents to interact safely while following social distancing. In conclusion, I want to thank Spurgeon Manor staff for all they're doing in this extremely difficult time and their concern and commitment to the residents. I know it's not been easy for them to care for their work family along with their personal family, and knowing this is a marathon and not a sprint makes it even harder. Yeah. Governor, we appreciate and will continue to need your support. Thank you.
Oh, thank you, Maureen. And I know that this has been a really challenging time for you and your staff. And I want to just thank you for everything that you're doing to continue to provide compassionate care to your residents and to reassure their families, whether it's through your daily emails or the drive-bys that you're providing for your residents. And please know if there's anything else that we can do to support you, don't hesitate to contact us. Keep up the good work, and please let your staff know how much we appreciate all that they're doing in this really difficult time. So thank you, and thanks for being a part of the press conference today. I really appreciate it.
Thank you.
So despite the aggressive mitigation measures that we've taken in our long-term care facilities across the state, We have seen, unfortunately, the virus has been introduced into some facilities, resulting in really some heartbreaking consequences. Currently, outbreaks have been confirmed in 35 of Iowa's 444 long-term care facilities, totaling about 7.8%. And sadly, about 57% of all Iowans who have lost their life to COVID-19 are residents of long-term care facilities. So throughout this time, the Department of Public Health and members of my team have been partnering with facilities across the state in just a whole host of ways to provide access to testing for both residents and staff. Testing is provided to any long-term care facility that requests it. They can be sent directly to the facility and administered by their own nurses for staff and residents. We can also coordinate through local public health departments, so they can also do that, or we have conducted countywide long-term care strike teams to provide testing as well. Testing of the long-term care facility staff can also be facilitated through Test Iowa sites that are in the area. Since May 1st, more than 9,000 tests have been sent to 94 facilities to test staff and residents. Strike teams have been deployed to 5 counties to test more than 1,300 long-term care employees across 40 facilities. And long-term care facilities within a county where a Test Iowa site is located have been offered the opportunity to be tested at the site, for a total of 286 more facilities and more than 16,000 staff. So in total, that's more than 26,000 tests for 420 long-term care facilities. That's 95% of our long-term care facilities in Iowa have really been proactive and taken advantage of the testing that we've been able to provide, so that they can really understand if the virus is active in their facilities, if it's active within their staff or residents. By increasing testing among the long-term care staff and residents, we have an opportunity again to identify positive cases early, with the goal of containing the virus quickly and preventing it from spreading. Again, the Department of Public Health has done an outstanding job of working proactively with our long-term care facilities throughout this time, from helping them understand the risk associated with the virus, how to mitigate them, and to providing guidance and staff protocols. But when any facility identifies a positive case in one or more residents, the Department of Public Health and local public health officials partner closely with the facility. So I have asked Sarah from the Department of Public Health to kind of provide an overview of what that process looks like today. Sarah?
Thank you, Governor, and good morning. I do appreciate the opportunity to talk this morning about outbreaks in long-term care facilities and what the department, local public health, and most importantly, staff in these facilities are doing to prevent outbreaks from occurring in these settings, and when they do occur, how to contain them and prevent additional residents from getting ill. From the beginning of this response, long-term care facilities have been a priority for us because we saw devastating consequences in other states once the virus was detected in similar congregate living situations. We know that the virus spreads quickly and efficiently in settings where people live and work closely together. And we also know that people over 65 and those with underlying health conditions are more susceptible to severe illness if they do become infected with the virus. As Governor Reynolds said, we have confirmed outbreaks in 35 of our long-term care facilities as of today. And tragically, 180 or 57% of the 318 COVID-19 deaths in Iowa have been among residents of long-term care facilities. Before Iowa had its first confirmed case of COVID-19, our department staff reached out to all 444 long-term care facilities in our state to discuss infection prevention best practices with them. These practices include things like proper use of personal protective equipment and what to do if a case is identified, like isolating ill residents from others. Additional steps were also taken, like those that the governor mentioned, including prohibiting visitors to prevent the introduction of the virus, requiring PPE use for every patient interaction within the facility, and yet, unfortunately, we have still seen circumstances where even the best efforts to prevent the virus from entering the facility have not been enough. Once a case is identified in either a staff member or a resident of a long-term care facility, our department staff works with the facility to review an extensive checklist of things the facility should do to prevent further spread of the virus. These measures include immediately sending any employee that becomes ill home or to seek health care, isolating all symptomatic residents in single rooms, cohorting staff so that dedicated staff are working with ill residents and not with healthy residents, recommending that employees use personal protective equipment at all times, even when not providing patient care, and helping facilities obtain enough personal protective equipment to do this, requiring screening of employees for fever and cough or breathing problems at the start and end of every shift, and screening every patient for fever and cough every day. As Governor Reynolds mentioned, we've also intentionally expanded testing opportunities. In addition to reviewing the checklist of infection prevention measures intended to stop further spread, we offer every facility with identified cases testing supplies so all residents and staff can be tested. We have set up testing locations for facility staff in a number of counties as well. Additional opportunities are still in the process of being scheduled. Facilities can also request test kits directly from the State Hygienic Lab by submitting a request through an online form on the SHL webpage. We often get questions about why we report outbreaks at long-term care facilities, but not other types of facilities, such as assisted living and senior care. While the department offers technical assistance and support to any facility that reaches out to us, long-term care facilities are an area we focus on related to outbreaks because these facilities constitute congregate living settings with a number of residents living in the same building and sometimes sharing rooms. It's much more challenging to isolate ill residents in these settings than in more independent living situations, such as assisted living and senior care. The impact of the disease is also often much more severe for individuals who are in need of the more intensive level of care that's provided in a long-term care setting, where staff must also be in much closer contact and in more regular contact with residents. Along with the tragic deaths that we've seen, we've also seen the amazing staff in these facilities work to contain the virus to ensure that additional residents do not become ill. Statewide, we have had 244 long-term care facility residents who were ill and they've recovered. For example, at Heritage Specialty Care in Lynn County, 45 residents who were ill have recovered. At On With Life in Polk County, 12 residents who had been ill have recovered. And at Premier Estates of Toledo and Tama County, 41 of their ill residents have also recovered. We will continue to work with our partners at the Department of Inspections and Appeals, the Iowa Healthcare Association, Leading Age Iowa, and local public health agencies to support all long-term care facilities across the state, including their staff and their residents. We know this is an incredibly difficult and frightening time, with residents physically isolated from their families and loved ones due to restricted visitation policies. Our hearts are with you, and we look forward to the day when family and friends can be together again. Thank you, Governor.
Thank you, Sarah. And I know how much many of these facilities have appreciated the expertise of the Department of Public Health, the epidemiologist, and everyone involved. So I just commend all of you for your grace with which you do it. I want to reassure Iowans who have family members in long-term care facilities that every step is being taken to protect your loved ones, from the Department of Public Health to the local public health officials to administrators like Maureen and the staff at each facility. We will continue to work with them and prioritize our long-term care residents and the employees who work in these facilities and who are on the front line each and every day, making sure that your loved ones are being taken care of. As we focus on those who COVID-19 most significantly impact, Iowans are doing their part as well by practicing social distancing, careful hygiene, and staying home when sick. Our actions really do make a difference. And so with that, we will open it up for questions.
Yeah, Governor Reynolds, you mentioned the validation process will mean increased testing numbers. how many tests do you expect Iowa will be able to conduct as a result of the validation?
Well, I think what we're saying is that we have the capacity to do at least 3,000 with the Test Iowa, and then the State Hygienic Lab is also has continued to improve their process, and I believe that Dr. Pentella thinks that they can do at least 2,000 a day through the State Hygienic Lab, and so that would be a total of 5,000 tests that we would have the ability of processing on a daily basis. As we're setting up these Test Iowa sites and we're doing the long-term care testing and some of the manufacturing and processing plant facilities, we also are making runs throughout the day so that we can get the samples to the State Hygienic Lab in a timely manner, again, with every effort being made to process these in a timely manner and get Iowans the results so that they know how to move forward.
Channel 5, go ahead.
Hi, Governor. Well, the President has said in his press briefings that anyone who wants a coronavirus test can get a test. Do you believe that's true in Iowa?
So what did she say?
Anyone who wants a test in Iowa, can they get a test?
So there's a lot of different ways that you can go about that. You can go to the testiowa.com site and you can fill out the assessment, and if you qualify, which we're opening the parameters now that we have the validation done, it allows us to even continue to open up those that will be testing. So that's one opportunity. You can also call your doctor or clinician, talk about the symptoms that you may have, and then they can make the recommendation or do the test if they have the capacity to do that. And as we continue to build out and we get to a place where we're testing healthcare workers, essential workers, frontline workers, first responders, there will become a time, I believe, that we'll be able to continue to open it up, and if Iowans want to get a test, they'll be able to do that. So that's kind of the approach that we're taking. We're probably not quite there yet, but as I said, we're continuing to expand the parameters that qualify for testing. And then the State Hygienic Lab are keeping theirs a little bit more narrow because we want to make sure if we would happen to see a spike that we would have adequate test supplies there too. I think is that accurate, Sarah? Okay.
Next question, Beth, KCRG.
Good morning, Governor. I have two questions about long-term care facilities. Dr. Burke strongly recommended to governors that all staff and residents at long-term care facilities be tested immediately. New York said it would be doing that every 2 weeks to catch those asymptomatic carriers. Will Iowa be taking that step? Secondly, Florida has started transferring nursing home residents who are COVID positive into hospitals in an attempt to stop the spread. Is that a strategy Iowa's considering?
So right now we have tested 95% of all of our long-term care facilities. So we've really been proactive in doing that. So, you know, we'll continue. I don't know about the strategy. I think right now they've got units that they're, do you want to take that one?
So right now, related to long-term care facility testing for staff, the offer has been made to facilities to provide staffing, either resources directly to the facilities, like I said, when a case has been identified, or through a variety of other options that the governor outlined, including facilitating testing through Test Iowa sites. So to date, we haven't mandated that long-term care facility staff be tested, but it is strongly recommended, and we're doing everything we can to make those opportunities available so that facilities can take advantage of those testing opportunities.
I'm sorry, but the numbers, I think, indicate that they want to be proactive and they want to do that. They want to make sure, you know, that they're protecting their staff, and they want to make sure especially that they're protecting the residents. And so, you know, we have a really high percentage that have already reached out and have done that, and we're continuing to reach out to the additional maybe long-term care facilities that haven't, but I know that's in the process as well. So they've done a really good job of being proactive and really taking advantage of the testing that we have available in the state.
Monica, Channel 13.
Hi, Governor. Thank you. So state lawmakers have determined that tomorrow, when a lot of the state is opening back up, it's not safe enough for them to return to their legislative business. Do you think they're being overly cautious with choosing to return later?
Well, you know, everybody is going to make their own decisions. I believe they are planning on returning back to the Capitol on June 3rd. I think they're opening the Capitol up next Monday, so you'll see some activity at the state Capitol. But again, you know, everybody has to feel comfortable in how they move forward with this. Even though we have eased the mitigation requirements on some of our businesses, restaurants, salons, churches. You still have individual businesses. Some are ready to open up and they're moving forward. Others are continuing to make sure that they can do it in a safe and responsible manner. So I think you're going to see, see it across the board. You're going to see some that are ready to move forward. You're going to see some that are going to continue to take a little bit more time before they decide to open up their business. And then Iowans are going to, take the responsibility to decide if they are ready to go out and participate at the businesses or go to a restaurant or, however they're going to gauge their comfort level as well. But it's not going to go away. It's here until we find a vaccine, and so we have to learn to live with it until a vaccine is finalized or approved through the FDA. And we can do it, and we can do it in a responsible manner. Iowans are doing that. They've demonstrated that, and I believe that with everyone's efforts, that together we're going to continue to move forward through addressing COVID-19 in the state of Iowa.
Ryan, Associated Press.
Yes, thank you. You mentioned that 4,300 Iowans have been tested through Test Iowa since, I think, April 25th. The goal of that $26 million contract with the Utah companies was 3,000 tests per day. Have you been satisfied with their performance to date?
Well, I have. It's been 3 weeks. It has been 3 weeks since we literally announced that we had partnered with not only Nomi Health, but with the State Hygienic Lab. This has been a great partnership. It really has allowed us to get over 500,000 tests, to be able to process that, to really modernize the system. We've gone from, to really automate it, from handwritten to a QR code that allows us to populate the information. And we are continuing to enhance the process daily. The data that we're receiving and that we're able to utilize in making the decisions is and has been incredibly helpful, and certainly will be helpful as we really address COVID-19 for the long term. So, we've in 3 weeks, as I've said, we've stood up 8 Test Iowa sites. We've done 8 strike teams. We've actually gone in and been able to work with manufacturing and processing facilities, and that's in conjunction with the State Hygienic Lab. So, I'm proud of the efforts. We've increased our testing by over 800%. Since in 2 months, and so we're moving in the right direction. It takes some time to ramp up. Now that we have it validated, I think you're really going to continue to see us be able to build out what we have the capacity to do with bringing them on board.
Next is Carroll Times.
Hey, Governor. In the past week, the Department of Public Health has removed the state's Epic curve from its website. The regional 12-point scale ratings are gone. Tracking deaths, where deaths are happening, is more difficult. There are no more daily press releases, and the new website data is inconsistent. Why, if this information was important to share before, is it being limited now?
Well, it's not being limited. We're trying to provide more access to Iowans, and we're trying to do it in a more timely fashion, so the data is more up to date. Do you want to talk about some of the other specifics?
Sure, and the other thing I would add is, just like anything else, we continue to look at the information. We continue to hear your feedback about the information that was previously provided that's valuable to you and that's not currently available. And so I can tell you that they're actively working to provide some of the more some more information, the sorts of the things that you're requesting. We just want to make sure we do it in a responsible way so that we don't provide the ability to identify any particular individual. So we're doing it carefully, we're doing it diligently, but we do expect in the next week or so to be able to provide some more functionality, and some of the things that you're referencing that are currently lacking, I would expect to see some of them come back for you.
I can even sense, I feel some of your frustration, because even as I'm trying to manage through the system, it's changed. It's changing daily as we're learning more and trying to provide Iowans with more timely information. I like the graphs, but it is changing and it is fluid right now. And as Sarah said, we're listening to the response that we're hearing from Iowans, and we're going to continue to make it better. We are collecting a lot of data, and we want to be responsible in how we display that, but we also want to be transparent with Iowans as well.
Caroline Cummings.
Good morning, Governor. Just to piggyback off of Ryan Foley a little bit there, you mentioned the amount of tests that have come through Test Iowa. But Governor Ricketts in Nebraska on Monday said not only the number of tests, but the number of positive results. I know you guys have said that you are not planning to siphon Test Iowa data from regular testing results, but after reported some delays and damaged tests, can you commit to sharing Test Iowa data juxtaposed to other testing? And don't Iowans deserve to know what the $26 million contract is getting that?
I think I've laid out pretty significantly what that has brought us. And honestly, we've been able to utilize some of the CARES funding coming from the Dr. Birx. She's really indicated that for states to move forward, we have to increase significantly our ability to test. We need to have a robust case investigation and contracts tracing system in place, and we've been able to do that by partnering with Test Iowa and the State Hygienic Lab. So that partnership using the CARES funding has allowed us to significantly bring in over 500,000 test kits that allows us to really scale up and be proactive in the testing that we're doing. In addition to the diagnostic testing, we're also doing serology testing. We're one of the few states that have been doing that, and we look forward to the data that we're learning from the serology testing that we're doing in connection with diagnostic testing as well. And the few things that you mentioned, whether it was tests that were spoiled or whether it was inconclusive tests, those things are not unique to Test Iowa. That happens with any testing process, even through the State Hygienic Lab, who has done a phenomenal job. When we sent some tests down to Southwest Iowa, we had unfortunately 200 samples that were spoiled and we had to retest. These are some of the things that happens when you're testing on a large scale like we are right now. And as I indicated, and I've said to Iowans, it's not acceptable. It's part of the ramp-up process. We're going to continue to work on process improvement. We're going to continue to learn more. I am extremely proud of the time and the due diligence that the State Hygienic Lab put into the validation efforts of Test Iowa. Normally, it was 5 positive tests that had to be confirmed with the CDC for the State Hygienic Lab, and they actually confirmed 100 positive tested before they completed their validation. So they went above and beyond to make sure that Iowans had the comfort level and that we had the comfort level that we needed in utilizing Test Iowa. So we're going to continue to report out the numbers the way that we have, and I'm proud about the capacity that we've been able to bring on board to provide testing and case investigation to Iowans so that we can manage and contain the virus activity, which is important as we continue to open up the state. Thank you.
Thanks, everyone.